Hi there. Can everyone hear me? Hi there. How's it going? I can't hear any audio right now. I'm not sure it's my end. I'm trying to see if there's anything I'm doing. On my,
Hi, can you hear us, Bill?
He's muted.
I can hear you now. Yeah, there you go. That's working. Yeah, I'm not happening there.
Okay, thank you, Bill. Thank you for bearing with me.
Yes, no worries. I appreciate you for bearing with me. I appreciate it. So I'm not sure if I missed anything here.
We were waiting for you to call the meeting to order. So whenever you're ready.
Awesome. Well, we'll go ahead and call the meeting to order. And if we could start with the roll call, that'd be great.
Director Leach.
I'm here.
Director Mraz.
Present.
Thank you.
Awesome. Thank you. Do we have any public comments?
No, we didn't receive any online and nobody from the audience.
Awesome. Okay, well, we have a pretty short agenda here today. So the main discussion item that we have, it's listed as an ongoing discussion regarding the urgent care and urgent care services. I'm not sure, do we have any sort of update on the PACE program or anything with Palomar or anything like that?
No, we have not. Okay, Rachel's not able to zoom in. She's on vacation today, but we have not received any further communication about any updates from either one of the entities you just mentioned. As of Friday last week, I think I hadn't heard new.
Understood. Yeah, I thought that potentially there was going to be an update on that PACE here today. Okay. Well, you know, it's basically on the it's on the agenda just because it's kind of an ongoing thing. I think it's definitely a strategic area that we need to address as a board. I think, and I'll let Barbara speak to it as well. I think that it's kind of been a commitment that we have as a board to put some sort of clinical services in there to replace some of the urgent care and some of that. I think we did a little bit of research on that a couple meetings ago, and I appreciate all the research that we've done so far. Coming out of that, I kind of had a discussion with Rachel regarding, you know, getting something figured out over there or whatever. Some ideas I kind of threw out there were some other I guess more innovative ideas that I've seen from other districts, maybe a nurse on standby during certain hours. I've seen there's different telehealth machines that do various urgent care sort of stability measures. And like I said, I think Rachel is in an ongoing discussion here with PACE and I believe Palomar as well for some stuff. But I think that as a board, we definitely have an ongoing commitment to try to fulfill that need somehow and figure it out. So Barbara, I'll let you speak to that if you have anything on that.
Well, the last that I heard from PACE, we were planning to go out there and the appointment couldn't be negotiated. It wasn't convenient for the scheduling at that point in time, and it was going to be at another date, which I haven't heard back. So I believe Rachel's in communications with them. And I believe that she was in communications with Palomar as well. But we were only beginning the negotiations and the talking about them perhaps providing services for us with the urgent care. I'd like to know where we are with the urgent care. It's my understanding that the doctor is still planning on being there, and it's going to be maybe another year or so. I'm not quite sure. I was hoping to get an update from Mr. Scott with regard to.
Are you referring to the Palomar, or are you referring to our current? Oh, okay, yeah, that's only something
Are we talking about Dr. Scott?
No, I think, you know, I'm just talking about an ongoing need for urgent care services in the community. I think that everything as far as that property over there is on time and on schedule. I think he's made all the payments that he needs to make, and I haven't heard anything, you know, to the contrary as far as him not continuing to do business there. I imagine he's, you know, picking up business and everything. I just think that, you know, as a community, there's definitely been a lot of talk about the need for more services. You know, I think that if we could get something like PACE in there at the wellness center, I think that that would be a good piece of it. Or if we could get, you know, like I said, some sort of innovative way to try to get more services in there. I think that that's definitely a piece that as a district that we can kind of fulfill some of that role. Like I mentioned, I had seen some other more rural districts do a number of different measures to try to address some of the same sort of issues. I would, you know, maybe talk to Rachel about doing a little bit more research about some of the different methods that we have. I think that we did some research on potentially putting in urgent care, but I think that there's some other, you know, alternative options that we could kind of look at as far as trying to provide some services. But that's kind of where I'm at with that, Barbara. I imagine you've heard the talk about needing more urgent care services and whatnot, you know, here in town. So
I would just say that I would like to, you know, put some emphasis on this and perhaps look at a timeline, maybe a window of, you know, the next, have something in place, let's say within 90 days. Otherwise, we're going to be kicking the can down the road, maybe a little longer, but if we keep delaying it and just ongoing, and it'll drag out, and then we're going to be into the fall. And then of course, when the weather changes, you get the more illnesses, you know.
I think
But
of the
winter-
timeline aspect, there may be a need for a longer term on that.
Really?
Where I do have, I mean, once I thought about it, I was like, I know after your appointment fell through, there was, Rachel, I think, reached out to them to actually get a bit more information on the details of the clinical services.
Right.
And, you know, they had a group of teams still out because of summer on vacation and stuff. So they haven't been able to pin those down. But in regards to anything about with Palomar, I don't think the 90-day window would be sufficient for us
We
to
need more
have
time
any
with
kind
that.
of turnaround on that.
Yeah.
From the little bit that she's shared in regards to the conversations, this is a very long-term plan.
Yeah.
I wouldn't want to tie her into anything, you know, but I think she's looking more into the 6 to 12-month window
Oh, really?
before there's an answer on any kind of interest and or details.
Yeah.
And that I might be reaching too far with 12 months, but I think that would be best from her because she mentioned to me it was at the very beginning stages of the conversation.
The comforting thing is that each one of the covered members, whoever has an insurance plan, would have a designated urgent care that they would be sent to if an emergency were needed in that area.
Right.
And I don't know that our doctor here handles all of that. A lot of them are designated to go out of Fallbrook to Temecula. And I don't know, I think Graybill is tied in with this one. And so that makes it a little easier. And I know that our first responders are doing a wonderful job. When they get a call, that they're there immediately to try to take care of things. It's just been an ongoing, you know, issue. We do want to have services available to our community members. And it's a little concerning that we've had how many urgent care centers in Fallbrook at one time, and now we don't have, but what, 2, I think 2 that are really functioning as full on. The one down at Mission and Fallbrook Street used to be Dr. Cohen.
Dr. Cohen, yes.
Yeah, I don't know what happened to him.
He got sick. He has cancer.
Oh, I'm
Yeah.
sorry.
That was it.
But it would be well to consider the growth of our community, and as we're moving into the summer months, to see if we can't firm something up and encourage these entities to participate as soon as possible, because maybe it's just me being impatient because of the COVID thing and everybody being put off, but what you'll find is that people will develop a reluctancy to do anything. And I'm speaking from my own personal experience within my family members, because of what happened with COVID. They don't want to go to the doctor. They don't trust what's out there. They don't feel they're getting accurate information. And you want to be able to provide the care for them, information. I mean, we have wonderful resources. And as long as we can continue on our website and at the Wellness Center to show, we have the ability to refer to different services.
Right, and to that point, she is keeping it top of mind. I do know that she's had communications with a different, I think, PACE organization as well.
Mhm.
So she is pursuing different avenues, not just sitting on the ones that she's mentioned.
Yeah.
I just don't know the name of the entities to provide you guys a very accurate update, but
Yeah.
I do know she's entered into a couple conversations to kind of bring those clinical services.
Right.
But I don't remember the name. I was gonna say, I know we discussed
And-
it briefly, but.
And I would say to consider in bridging the gap, during the summer months, to educate our community members on some of the things that are the occurrences that cause an urgent care concern during the summer. So you're looking at heat stroke, you're looking at the swimming pools and the children. So to get the information and have it available, at least on the website, to address certain things, perhaps hydration, the most important thing. Are you getting enough water? Do you know if you're getting enough water? Are you taking medications that are diuretics? Do you realize what's going on to keep yourself balanced? Do you know what your electrolytes are? So to make them aware, make our community aware that you can be your own healthcare advocate by following certain protocols so that you can take care of yourself and know when it's time to go to urgent care. Because a lot of it is putting the information out there so that that individual can make those decisions for themselves and their families. And I think that's the first line of defense that we have. They can, of course, always call their doctor, but it's something that the community is going to continue to need. It's never going to go away.
Right.
So the more information, information is power, encouragement, and getting people to, be aware of the damages of sun and the effects of the sun, just little things, cover up the kids when they go up, put a hat on them, sunscreen, that kind of thing. Just to have those little bits of information available. And then the rest, of course, they will probably call their doctors and get information. But we can only help in that way until we can get another individual or entity to participate over at the Wellness Center. And I think it's there. I think that the concern is there, the interest is there. It's just getting through the bureaucracy, the red tape and the paperwork, because people change, they go on vacation, something gets put on the back shelf, and then the next thing you know, is pushed off to the side. So it's just keeping that topic in front of us to keep us motivated to cross the finish line at some point in time and get as much information as we can to our community members about healthcare issues and concerns, like the fentanyl issue with the kids right now, the drugs. And I know we cover a lot of this in the community health and wellness, so I think we do a good job with that, but there's always room for improvement until we can get something going on. Keep calm, hydrate, carry on, put your feet up, watch your blood pressure. These are things that people just, they take for granted. They just think they can keep going and going. And we are not machines. We do need to stop, rest, cool off, watch our body temperatures, watch the temperature outside, and make sure we're eating carefully, watch the salt, that kind of thing. And especially for our seniors to have places where they can cool off, like the library, the wellness center, etc. So that's just my contribution.
Is the wellness center cooling? Not at this time, but it is our goal. Like in the future, it's another project we're working on in terms of the parking lot and structures for solar and battery backup and stuff like that, so we can accommodate that, in the future.
You mentioned we have urgent care people. Is it okay that I speak?
Yes.
I
acknowledge you.
the urgent care, you said we have several of those in
I
town?
think we have an urgent care through the community, CHW down there by the Northgate Market. They have extended hours for
You're
urgent
referring
care
to
there.
the Family Fallbrook Health Center?
Yeah,
Don't they have an urgent care in there?
I don't think so.
No?
I don't, no.
Yeah, I don't think so. I think that there's maybe an urgent care across the street by like Rite Aid, but I don't know that they're open extended hours. I think. But just to speak to the the urgent care question, my thoughts aren't necessarily that it's like short term, like, hey, we need to bust it out in the next 3 months thing, but this committee is more in looking at long-term, more strategic sort of elements, and just judging by the need of the community, and a lot of the comments that we hear regarding like the need for some sort of clinical services. I definitely think it's something that we should look at. So.
Yeah.
Yeah, no, she is keeping it top of mind and she is researching it and she'll probably provide a much better update next time she's here with us in regards to the entity she's beginning conversations or having, I know she's gotten into more and more of them. And she does have it for the meeting, but we didn't have it.
Do you know what the agreement is with this one right here?
I do not know the
'Cause they're
the
never
details of
there.
the agreement.
Yeah, they're,
We
Or I should say no,
have,
but
yeah,
they're
we
really-
have an agreement with them. They are their own entity.
oh, is
So,
that right?
yeah, they're not funded by the district.
Oh,
We
This
don't
is
have
an
any.
independent entity.
they are,
They
yeah.
rent the facility.
Purchased.
They did
He purchased the facility, if I'm not mistaken,
Mm-hmm.
and what our involvement was to finalize the lease negotiation agreement to become,
Through the purchase.
he's the purchaser.
At one time, the district did provide additional funding for extended hours. But because they're a for-profit entity, we
Right.
can only do that for a limited period of time. And we did request would they be interested in becoming a nonprofit in order for us to continue that funding, and there just wasn't interest on that position's end. And so that's why even with that funding, the amount of traffic he saw wasn't able to sustain it, like his business with the extended hours. So it just has to do with our population size.
Yeah, he also holds a position in Barstow, the Barstow Hospital, so
Okay,
he's got a tight schedule, I'm sure.
Well,
yeah,
because many times that I'm there, you cover my staff, and there's nobody there who can handle it.
Yeah.
I have to send my people to Temecula. They won't take workers' comp. They won't do, so I have any kind of issue. Used to be, I used to send them to Dr. Cohen. And I was saying to Raquel, they'd be in, they'd be out, they'd have the medications, paperwork, everything taken care of, no problem, and they'd be back on the job in an hour. Here, they won't even see them because they will do workers' comp. And even if I say I'll pay for it, they're not interested, won't take it. I don't know how they operate, and when other times when you go, there's nobody there.
Yeah.
It's locked down. So and when you do go, several times, I think I went for a COVID thing one time, and they could take the test, but they couldn't interpret it or something. They had to have the doctor there, and he wasn't there yet, he would be there. And paid $90 to take the test. So, I mean, the services are, I don't know whether it's the health insurance agency, but we were paying cash. And so I don't understand, why they're even there. I mean, I can easily see why they don't make money, because people are they don't get service there.
Yeah. There's a lot of changes, I think, that are going to be coming down the pipe with our medical industry. There's people are hesitant, they're questioning, they want to get accurate information, and it's going to be challenging for a while. I think even the insurance companies, we've got insurance companies that are pulling out of California. So we've got a lot of things that are going on, and there's supposed to be new technology coming in too, which I hope, knock on wood, if it happens. We'll just have to wait and see, but in the meantime, we have our website that we put information out on. We have a calendar of events at the Wellness Center that address a number of topics. We know that Rachel is actively engaging with different entities to bring this urgent care discussion to the presentation of some sort so that we can put some legs on it and let it take on a life of its own. So we're kind of in that plodding along stage, which is, it's awkward and frustrating, but it's part of this.
Part of the process.
Yeah, it's kind of like being pregnant. You know, it's gonna come at some point in time and you're like, I want it.
Nice. Yeah, I'm not sure if I understand that one, but okay.
Yeah.
Awesome.
Get us through it. Okay.
Yeah, so that's really it for me. I mean, I think that obviously you know, it's something that I need to kind of talk to Rachel a little bit more about, and the board needs to discuss with her. But you know, it'll definitely be an ongoing discussion that we have, and hoping to you know, figure something out here strategically for the long term for sure.
Okay.
All right. Do we have any other comments on this issue? No.
No.
Yeah, like I said, not a whole lot. Like I said, I didn't realize Rachel wasn't going to be here today. Otherwise, we probably would have got a little bit more updates there. But I appreciate everybody coming out. Thanks, staff, for coming out and putting everything together. I'm sorry if my connection wasn't the best the whole time. Also appreciate the audience coming out. It's always nice to hear you know, a different perspective and hear you know, people's perspective about the things that we're doing out there. So, you know, appreciate you guys coming out. And do we have any other future agenda items? Barbara, anything that you want to discuss, you know, like potentially for the next strategic planning committee meeting? I mean, obviously everything's like more long-term. Any sort of long-term things you want to look at?
Not at this time. I'd like to talk to, make an appointment and talk to Rachel and see, you know, where she's at in the scope of things so that we don't jam up her schedule, but to make us talking points for our future agenda items. Because I'm sure that she would have a lot to contribute, because I just don't have all the data right now.
Yeah.
So.
Well, I appreciate that. You know, I think we're kind of in a good spot overall, you know, with the way that things are going. So strategically, it's not like we're needing to, you know, switch things around every month or anything. But I think that definitely the urgent care issue overall is something that we need to kind of continue to look at, whether we're able to contribute something to it or collaborate with other groups to bring something to Fallbrook. But I definitely think that would be a big piece, you know, a big accomplishment that we can give to the community if we're able to provide more in that area. So that's it. Anything from staff? You guys have anything? No?
Thank you.
All righty. Well, I appreciate everybody's input. Barbara, I think that was actually really good information and good ideas about putting out some public awareness campaign for different things. I think that's, you know, something maybe we could talk about at the, you know, public information sort of meeting or whatever, kind of discussing getting some of that, more of that information out. But appreciate that and everybody's time, and I'll go ahead and adjourn the meeting here at 6:01.
Okay, Bill.
Thank you.
Alrighty. Thanks.
Have a good
Thanks everybody.
evening.
Okay.
All right.
Thank you.
For citizen stuff.
Oh, yes.
So
you
for
do. Okay.
August, yeah.